There are multiple ways to obtain natural results in breast augmentation. One of my favorites is using the subfascial plane in a patient who's a candidate for the subfascial technique. Now, what does that mean? There are different ways of putting the implant in. Obviously, there's an incision, but then once the implant is placed into the body, there is what level to put it in. Most people talk about an under the muscle or over the muscle technique. Well, there's one that's kind of in between. It's called the subfascial, and that's the technique I prefer, because it makes it so that the breast augmentation does not have that abnormal animation deformity that occurs when you put the implant under the muscle, and it leads to a much more natural slope to the breasts when I use a shaped anatomic implant. So I like this teardrop shaped implant because it's flat at the top here and then has a nice fullness on the lower pole like a natural breast does. And in the subfascial plane, you can really see the shape of this implant. You don't see the roundness of a round implant because the fascia pushes down on the top part of this implant, and then it gives that really natural fullness on the lower half of the breast, which people are looking for in order to obtain a really natural breast augmentation. So for those reasons, I prefer the subfascial technique when the patient's anatomy allows me to use it.